Hello, everybody, and very welcome to the 16th episode of the Brain Function series, coming to you from the Togetherness Media, Los Angeles. This is Mohammad Nami, and I'm very pleased to be sharing with you some further insights regarding the way that the brain puts together functionality, specifically when it comes to a period of time that we spend asleep. So for the context of dreaming, which is the focus of our discussion today, there has been lots of different studies over the several decades, and mainly psychologists have been deep diving to understand the reason and the structure, the idea, and the function of dreaming. So they've been thinking back in the Freudian time, and the theories brought about by Sigmund Freud. The reason behind that, why we dream, is that we got some suppressed ideas, wishes, and also fantasies and goals that we do not have the chance to express them in our wakeful life, but we are just going to go through the reiteration and reprocessing of those thoughts during the period of time, which is called rapid eye movement. And that was the extent of it. And it was not experimentally studied, and it was not systematically, scrutinized for the past several decades. But more recently, fortunately, neuroscience and cognitive neuroscience have used the objective assessment tools, including the brain mapping and neural imaging, and also different kinds of neuropsychobehavioral approaches, to systematically study the reason, the structure, and the dynamics of our dreams, and also our dream content analysis. So based on this, we recently have had a wider understanding of, first, the necessity of the dreaming period. The rapid eye movement, when we have the to and through movement of the eyes during a specific time in our sleep, which is called REM, as I said before. And this is like a paradoxical state of our sleep. This means that we, as if our brain is kind of like very close to the state of wakefulness in terms of the patterns of the oscillations or the brain waves, but it is very hard and difficult to awake the person from REM sleep, as if a person is now in the depth of the sleep, right? Okay, in this period, we not only have this eye movement, but also we have the normal paralysis of the whole body muscles, except the respiratory muscles and the eye muscles. So there is no voluntary movement. There is no even involuntary movement. So the literally and normally the body experiences the normal paralysis, based on which our body is going to get refreshed. The musculoskeletal system will get the chance and opportunity to get revitalized and get rested well. So within this period, the brain has different patterns of oscillation, and the oscillation is mostly low voltage, and it's rapid frequency. And that based on that, the idea started to emerge that, well, the brain has some emergence of the brain waves from the deep-seated temporal and the lateral structures of the brain, all the way up to the frontal, very frontal, and the anterior part, the front part of the cortices. And by this, the brain has this random firing, the neurons and a population of neurons, and based on this, some memories and some cognitive motives are going to be incidentally ignited. They will be presented, they will be processed and reprocessed, and by that we can have the subjective feeling of seeing things, hearing things, interacting with the environment and stuff like that. And also we can recall at least like 40 to 60% of the dreams that we have. And dreaming is important for reordering and reorganization of our cognitive motives. And the question was that, what did they mean? And if I'm dreaming about something quite repeatedly every night, does that imply anything? So am I suffering from any kind of neurological psychiatric problem? If I do not recall my dream, what is the problem? So according to the evidence-based medicine and the most recent advances, it turns out that the idea of linking the dreams to any specific function. For instance, when we dream about, I don't know why, but it has some meaning in the wakeful life, it is not really true in a sense that this is not backed up by the scientific evidence. But we have the dream content analysis. This means that we're going to get the report from the dreams of the people, and then we're going to go for the statistical analysis in like group data sets. And then we're feeding this into the machine learning and artificial intelligence. And by this, we can imagine that if this patient has got this the content and this flow of the dreaming scenario, at what percentage there's a risk to relate or cross-link this kind of dreaming experience to schizophrenia, to anxiety, to depression, to early states of memory loss, or whatever, all right? So these are the kind of, statistical models and also scientific approaches to analyze the content of the dream, which is called DCA, or dream content analysis. So let's forget about the traditional, like old age way that they were kind of, relating the content of the dream with something which is supposed to be happening in reality. And of course, when someone is over dreaming, if someone complains about, well, dreaming's all the way. I mean, the person, when the moment he falls asleep, starts dreaming, and the dreaming is sometimes iterative, sometimes it is not, random, about different things. This is something important, because based on the studies, we know that when we have the dysregulation of the mood or affective disorders, there are evidence supporting the fact that we got elongation or disproportionately increased REM periods during sleep. So depressed people, or the people who are suffering from a range of affective disorders, including anxiety, depression, PTSD, or phobias, post-traumatic stress disorders or phobias, they happen to experience more dreaming. So by prescribing some medications where just shrinking the REM density of the REM periods, and the person will explain less dream content, and by that the brain will get a chance to just go deep down into the states of non-REM sleep, where the brain has the slow wave activity, and the brain gets the ability to get cleared off from the waste materials and the inflammatory toxic agents, all right? So it's important. So the less REM we have, the better chance the brain has to go into the slow wave activity, to deep sleep, and then the better functionality and wakeful performance would be expected from that person. And another hypothesis, another idea to tap into was that at what level we can correlate and contribute to the understanding of psychiatric problems based on the dream content analysis. Do people with schizophrenia dream any differently from the other people? Do people with multiple sclerosis, with anxiety, depression, Parkinson's disease, dementias, do they really dream in a different way? If it is, at what percentage can we predict and prevent earlier stages? Those diseases as earlier stages, based on the dream content analysis as an extra, a corridor towards understanding this kind of problems and detecting and timely diagnosing this kind of issues or neurological psychiatric problems at the very beginning. So dreaming is important, but when dreaming is overt and we have over dreaming, something is not right. We need to see a doctor. When we have dreaming is an unpleasant way, which is turned into nightmare disorders, and we have got apprehended wakes. We wake up with shortness of breath, with tachycardia, or racing heart. Also, we have sweating and stuff like that, and we are so anxious when we wake up at the middle of the night. So something is not right there. So we got to be consulting a sleep physician or like a sleep expert. And based on that, we might need to undergo the sleep test or polysomnography, check the status of the different stages and cycles of sleep, and based on that, we might be undergoing neurological psychiatric interventions. Sometimes it would be pharmacological, sometimes non-pharmacological, but whatever the case is, we need to get tested. We need to get better diagnosed. And just to close off this conversation today, I'm just going to tell you a story about one of my patients. About a couple of years ago, a patient came to my office and it was complaining about a repetitive dreaming content every night. So he was telling me, doctor, I'm having just experience over and over again on this dream content. Every night I dream about And I have this sort of nightmare, unpleasant experience of dreaming that I'm losing one of my teeth. And I've read in a book that is about dream interpretation, which says that I probably lose one of my loved ones. So one of my family members or relatives, God forbid, will die soon. So is that real? Is that true? I'm so worried about this. And a person was quite, anxious, and his anxiety control was all over the place. And I examined that patient, and I found out that, well, we have some issues with the temporal mandible joint here. So when he opens the mouth and closes the mouth, there's a click here. So we have this subluxation of this joint, like this. And there is a click here in this specific temporomandibular joint, or TMJ. And when I looked at the denture was not good. It was not in a good shape. Also, he had got problem with the occlusion of the mandibles, and it got very small and like a backward oriented chin, which we'll call it micrognathia and retrognathia. And when we examined the sleep for this case, it turns out that this patient has got like over 40 times of tooth grinding, or what we call it sleep bruxism. And he was like grinding the teeth again, upper and lower mandible. He was just grinding the teeth like this over and over again during the night. And based on that, we kind of corresponded the tooth grinding and sleep bruxism to the kind of specific arousability and the experience of the dreaming content that he went through. Then we treated that kind of problem with the help of our colleagues at the dentistry department. And then all of a sudden, the patient came back saying that, okay, I'm sleeping really more efficiently, and I wake up quite refreshed in the morning, and I do not dream about losing my tooth. And fortunately, no one from the family or relative lost his or her life. And what I'm telling now is about the scientific approach to interpretation of dreams. There is a reason behind it, and the reason needs to be found out. It needs to be supported by facts and figures in the evidence-based medical approaches. And hope you have a very good experience with your dreams and your sleep as well. And we're going to catch up later on discussing about different dimensions of how the brain works, and the idea of putting together things, how we can live a better life in terms of our brain health, cognitive health, behavioral health, and also our quality of life. Thank you very much for following this and turning in for this series of discussions. We'll see you later. Appreciate it.
Togetherness Media. Togethernessmedia.com.